Hello, welcome to Knowledge on the Go, the podcast brought to you by the Vizient Performance Improvement Collaboratives and Knowledge Transfer Team. I'm Nicole Spatafora, Senior Director of PI Collaboratives and your program host. Today's podcast reflects some of the findings from Vizient's collaborative, Staff Wellbeing, Coping with Crisis Events.
It was very stressful for all of us at Rush to see that this was coming, and we wanted to be as prepared as possible.
Ann Burgeson is Associate Vice President of Strategic Communications for Rush University Medical Center, a 671-bed AMC located in Chicago. Her department became a key player during the past year. At the end of February 2020, Rush's leadership gathered to make plans for what they had heard was a tsunami of COVID heading their way.
A hospital incident command was set up quickly, and that really is a group of people that represented every aspect of the organization to determine what we would need from everything from supplies, communications, our labor pool, as well as how we would surge within our space in the hospital, really preparing for what we did not know yet would be having hundreds of patients at a time in the hospital.
Rush had done this before. They knew how to prepare for infectious diseases like H1N1 and Ebola. They knew how to handle those.
This felt different because of the scale that we were expecting based on what we were seeing both on the East and West coasts.
Rush and the city of Chicago had their first COVID patient on March 5th. He was a young man returning from a trip to Italy, and he made a fast recovery. But then Rush experienced a tsunami of COVID patients over the next year.
We had approximately 3,700 patients who had to be hospitalized for COVID-19 and were later discharged, and another 20,000 patients who were tested positive for COVID-19 but weren't sick enough to be admitted.
Communications became important during this time. There was so much to learn about the new illness and so much to teach employees.
So from the beginning of COVID, we started with a communications plan that we continued to build upon. And really, this was a team effort within communications and working closely with our colleagues from the command center. So senior leaders certainly bouncing ideas off of and working closely with them to make sure that what we were recommending, they were comfortable with. So really a lot of collaboration and teamwork as a group to make sure that we were coming up with a plan that was workable for the organization.
Information was changing constantly, and the staff was anxious and thirsty for facts.
We did have people nervous, so we made sure that we did whatever we could as an organization to address those concerns and convey the answers to their questions in all of our communications. Some of the biggest rumors were around misperceptions of we don't have enough PPE or someone's hiding the actual numbers. So that was the reason to make sure that we were very transparent in our communications so that rumors didn't have a chance to take root.
Clear communications was essential. Graphics, photography, video production, marketing, and advertising. They all had to have consistent messaging.
I think that was really incredible to work together as a team and not even see the differences in the kind of content you're creating, but all be driving towards one purpose and in such a clear way. Really felt like this has been a huge communications challenge for all of us and really proud to be a part of the work that we've done at Rush.
Rush Communications used every means possible to spread the latest information, ensure it was accessible and easy to understand.
In the midst of COVID, we were sending out e-newsletters 7 days a week, and we were amazed by the numbers of the open rates of those e-newsletters, which were between 15 and 25,000 opens on our e-newsletters. So really that told us, based on the fact that we have about 12,000 employees, 2,500 students, people were opening these messages numerous times, which we felt we were giving them information that was useful. We were also hearing a lot of the information back from employees as our leaders went on rounding, and that people were really reading those closely and believing the information that they were getting via email every day.
Rush made their internet accessible to employees at home. They could catch up on the latest COVID information, read articles, positive stories, and message boards.
On our intranet site, we have a Q&A board for employees to submit questions, and we, our communications team, answer those with help from our infectious disease colleagues.
Senior leaders were involved in getting the word out to staff by rounding 7 days a week.
Senior leaders not only answered questions during rounding, but also made sure to thank staff, because we know that's really what people needed to hear. Direct messages from our senior leaders about how grateful we all were that they were coming to work, caring for our patients in such an amazing way. We also had town hall meetings twice a week at some critical times and at least weekly through most of COVID. We had in the least 1,500 employees join those meetings. At the highest, we were typically getting about 3,000 employees joining those meetings via WebEx. So really people were eager to listen to these, and we were happy to be able to join together and answer questions quickly. Again, this was another way to really make sure that staff were hearing information directly from leadership and not believing any rumors. People trusted the communications we were putting out because, again, it was 7 days a week. They could check the information as they were hearing it. So you might hear it live during a huddle or as leaders were doing rounding, and people would check those numbers sometimes as they came out via email. And it sounds crazy that email was something people were relying on so critically, but certainly at Rush, when that message went out, we would hear questions back right away from staff. People were waiting for that every day to see that message.
The communication plan was extensive, with many different teams involved: communications, clinical, and leadership. Anne says it was well worth the effort.
In our engagement survey, which we did in the fall, we saw our numbers were still high. One of our videos featured a nurse talking about how when it got tough, we got tougher. And I feel like we heard a lot of that from staff who felt that they could do this and they could get through it, and that they were truly built for this. It sounds surprising to say you're excited to be coming to a hospital in the midst of COVID, but people were excited to come and do their jobs.
Rush also made efforts to support the community. They wanted to make sure the latest COVID information was widely known so that everyone in the community could take the necessary precautions and make educated decisions.
We've done many things to communicate with our patients and our broader community to make sure that they were informed about everything related to COVID-19 as well. On rush.edu, our website, we have many resources available, again, with videos, articles, a whole set of Q&A about both COVID-19 as well as the vaccine. So making sure that we're answering all of our patients' questions, our students, our larger community, to make sure that people feel supported. We have a whole community resources section of our website devoted to community information, and actually had a separate command center just related to community efforts.
Being in communications during the COVID pandemic required hard work, long hours, and personal sacrifices. Anne is grateful to have played a part in the solution to this terrible problem. It's something she's prepared for throughout her career.
We've been preparing for emergencies in so many ways over the years, and now seeing this put in place was really meaningful to me. Again, to see the importance of communications in this emergency and to see how hospitals really stepped up and did so much in this time to help people around the world. So really, it's been extremely meaningful to me to be a part of the organization at this time.
Thanks to Anne Burgeson from Rush University Medical Center for sharing her story. And thanks to you for listening to our podcast. We'd love to hear from you. Send an email to knowledgetransfer@vizientinc.com. From the PI Collaborative and Knowledge Transfer teams, I'm Nicole Spatafora. Remember, knowledge is transformational. Share it.